Welcome to Side Effects with an A. When effect is normally used, it's a noun. It's already occurred.
Effect is a verb meaning action. Action influences outcomes.
I'm Scott McGohan.
And I'm Anne-Marie Singleton. We will provoke you to think differently.
Side Effects, where problems are defined, solutions exposed. Welcome to Side Effects. I'm Scott McGohan.
And I'm Anne-Marie Singleton.
How are you, Ann?
I'm doing great today, Scott. How are you?
Oh, fantastic. We've got a guest with us today.
We do.
Derek Curlee.
Welcome, Derek.
Thank you. Thank you for having me.
You're welcome.
Yeah.
I hear, we hear you rap a little bit on the side.
I'd like to focus most of the time today on that, actually.
Would you really? Yeah, that'd be good. Yeah, I kind of like
give
that.
our listeners something a little bit different.
Yeah.
So that's really cool. How'd you get started doing that?
We don't need to talk about this.
I'm kind of with you. Yeah, I completely agree. You know, it's just that random conversation that just goes nowhere really, really, really fast.
So,
exactly.
But Derek's with us today with a group called Airrosti, right?
Airrosti Rehab Centers, yes. And we're, do you remember the acronym?
I think I remember the acronym. We'll try it. You can help me.
Can we wrap it?
Yeah, there you go.
Okay, good.
To say the first one, applied
integration for rapid
recovery of soft tissue injury.
That's right.
Yeah. So if I'm a listener, you and I just heard, blah, blah,
Yes.
blah, blah,
Right.
blah, blah,
So
blah.
you just can remember.
So what is Airrosti and why should it mean anything to our
Yeah,
listeners?
the important part of that is the soft tissue injury part. We are a provider group that focuses on musculoskeletal, and within that scope, specifically sprains, strains, and chronic pain. So our goal is
kind of like Dr. Seuss, sprains,
Yeah.
strains, and chronic
That's
pain.
my non-clinical layman kind of way of explaining it. And essentially, if somebody has pain and it's not from a fracture or a full tear, our doctors do a great job of getting them out of pain.
Yeah, so Derek's with us this morning because he was in doing a learning center here in our building for a handful of our employers. 40 or so employers came to hear about Airrosti and what it can do for them. And we asked him to join us here so the rest of our listeners who didn't get to come in today could learn a little bit more about this service.
Well, and it's a big deal because at 30,000 feet, the claims in this area for an employer are off the hook. And then generationally, as we talk about hips and knees, often in the future healthcare cost, it is just an insurmountable mountain.
Yeah, so we've talked a lot about claim costs, what drives claims, doing biometric screenings, those types of things, avoiding those large claims or catching things early. This is even a little bit more granular than that. So when we look at employers' claims, normally musculoskeletal, which we'll refer to as MSK, is number 1, 2, or 3 in
Correct.
terms of claims costs.
Well, then and stack on top of that, pain medication
Right.
is normally 1, 2, or 3.
Right. And
Which
so
alleviates what? Normally back pain.
Right.
Yep.
Right.
And so if you do a biometric screening, I mean, we want you to do that, but that's not going to do anything for the musculoskeletal claims for the most part. We're not working on that when we're talking about those types of claim reductions or keeping people healthy. And so this is an alternate treatment to help reduce those claim costs by avoiding surgery, reducing RX costs, and reducing the length of time, right, that people would
Absolutely.
be receiving treatment. So instead of 20 visits, maybe they've got 4.
Right.
I don't know. Let's talk a little bit about that.
A couple of years ago, Truven released a study where they were showing, within employer group health plans, what were the biggest cost drivers. And you guys nailed it. Not only was musculoskeletal on average number 1, but it was also the fastest growing. And when we sit down with employers and HR directors and benefit managers and we talk about, what are you guys doing to try to control that, you get a lot of blank stares. And you look at a common, let's take your wrist. Somebody wakes up with wrist pain. They don't know what it's from. Number one thing you want to do is get out of pain. So most folks are going to a primary care doc. They're going to an urgent care
Or the
ER,
cabinet for some Aleve or
ER.
Advil.
Yeah, and you're walking out the door less than 10 minutes later with a painkiller or a muscle relaxer, and you're being sent out for an MRI or an X-ray. It's right off the bat. And that's just our traditional route of care for musculoskeletal. From that point forward, patients are going any number of different directions. You've got orthopedic specialists, injections, pain management therapy, PT, chiropractic, and folks don't really know what to do, and their employers aren't helping them or guiding them.
Yeah. Well, I give you a quick example. So I went to Airrosti myself for something for my elbow. Both my kids have been there. But prior to me going, I had 20 weeks of physical therapy on my arm and thought it was okay until it wasn't okay. And my son had about 12 weeks of physical therapy on his knee, and it didn't get any better either. And so we hadn't been introduced to Airrosti at that time. That was, 5 or 6 years ago. And I actually hadn't thought about it. I was complaining about my elbow to our president, Mike Sutman. And he said, well, why don't you go to Airrosti? Because he had been. And I was like, oh, I hadn't thought of that. And I went and I had 4 visits, and it's been great. I mean, it's just a different way to treat that injury.
I think what I like about it the most, what I've heard, because I need to go
Yes,
because
you
my
do.
wrist hurts, is historically what I want is I just want the pain to go away.
Yeah.
And what I hear about Airrosti, which I adore, is you want to find out what's causing the pain.
So the number one indicator for surgery is pain. So if you can get that patient out of pain, we're going to reduce the need for an MRI, and we're going to reduce the need for them to have a surgical consult, which is going to be your biggest cost drivers. So the way that we have set up the way that we provide clinical care is we hire these doctors who are fantastic at getting people out of pain quickly. A treatment with us, and Anne-Marie, you can kind of attest to this, it's a full hour, it's one-on-one every time. So by allowing that amount of time with the patient, our doctors are getting really good diagnoses, and they're getting that patient sent down a treatment plan that's going to really help them. If we're not the answer for them, we're usually going to know that in the first 1 or 2 visits, and we'll get them pointed directly where they need to go. The treatment itself, it's nothing that we came up with. It's not, people hear our name and they think some kind of voodoo treatment. It's manual therapy combined with active rehab.
Yeah. So manual therapy, for those of you who are listening, means they are going to poke their thumbs in places that it hurts,
Yep.
right? A little bit. So, you either going to laugh or cry when they're doing it. They're going to be, re-tearing some of those tissues so that they can heal in the appropriate place, right? But that's what manual therapy means, is they're going to use their hands on your body. If you ever had a massage, a medical massage or something like that, it's a little bit more intense than that.
Yep.
But immediate relief. Immediate. I was like, how on earth did this just hurt like you know what? And now it feels so much
Well, I think
better.
it's the science behind what's causing it and where. So we were introduced to this through a firm in Dallas, our friends at ACAP. So there was a gentleman there. His name's Bill Henry. He was the founder of MHBT. Great guy. Had a shoulder surgery. And he was explaining to us about Airrosti and said, hey, let me introduce you to my $17,000 shoulder. I had surgery on. And let me introduce you to my $700 shoulder. Now, he can afford both shoulders, right? But actually, this shoulder he had surgery on actually hurts more. So, and he's in the healthcare business, and he's saying, look, this organization not only saves people time and money, but the risk of surgery is gigantic. And what you're not saying is surgery isn't necessary, right? Which
Correct.
you are seeing.
We're not anti-imaging. We're not anti-surgery.
Correct.
We just want to prevent it if we can.
Yeah, and what I think is so cool about this is because I always want to know how this gets started, why you doing it, and is this too good to be true? Because people who are listening are probably thinking, yeah, right. But it started in athletics,
Yes.
in pro sports, right?
So we started about 12 years ago down in San Antonio. And yeah, like you said, our focus when I joined about 10 years ago, all we were talking about was athletes and sports because that's really our bread and butter. How do we get somebody back on the field within a couple weeks when their contract is holding them out for 4 to 6 weeks because of an ankle sprain?
Right.
And so you really raise some eyebrows when you're able to get somebody. Take Tony Parker, who's one of our spokesmen now, getting him back in the playoffs for a game because of an ankle injury is incredibly valuable. And so for years, that was really our focus was athletes. And we were actually approached by a carrier in Texas who said, what you guys are doing is what we feel is missing in the musculoskeletal space for our employer clients. And from there, we've really worked hard to develop a program that allows us to, number one, engage plan members, teach them how to stay out of our office through prevention. But at the same time, we're educating them on something that's part of their benefits plan that's going to get them better a lot faster. And we hire these doctors, we train them on our treatment model, and then we place them into our markets to be able to impact those employees.
Which is why it's a big deal for us, because if you talk about, McGohan Bravender's vision, right, of empowering business, productivity is a big part of that. So if I've got a workforce with back pain or pain, that affects the employer.
Yep.
But it's bigger than that because it affects the person. So that's around empowering people and then ultimately empowering healthier living. So unpack some of the facts that you even shared with our guest today that came in the
Sure.
in the halls of MD.
So we have tracked our outcomes for close to 10 years. So as a patient, you're walking in the door, we're getting a pre-treatment pain level, post-treatment pain level, and improvement level. And then when we're discharging you, we're asking you 4 questions. Did we fix you? Did we prevent a recommended surgery? Did you reduce or eliminate meds? And do you plan to seek further care? Those 4 questions are really what are the most important for us because it's keeping our doctors accountable to us as a company, and it's keeping us accountable to the carriers, the employers, and you guys. And so we've tracked that. We have close to 400,000 of those in our database now. We know on average about 88% of our patients we're able to resolve. The ones outside of that, again, it's probably fractures, tears, unresolved cases that we just weren't the answer for that we're
Right.
getting sent down the road. And within that, we've prevented close to 6,000 surgeries that were already scheduled or recommended.
Wow.
Over 90% of our patients say that they reduced or eliminated use of meds. And then about it's 99.7 say that they would recommend us to friends and family. So we've taken those outcomes and we've been able to build the relationships that we have with carriers. But the question becomes, are you guys actually having an impact on the cost side? And so what we did was we went out and we commissioned Milliman Med Insight to be able to show, Airrosti is actually making an impact. What they found was in a 180-day episode for a musculoskeletal, so take some kind of knee pain, on average, an Airrosti patient is going to spend 39% less over that 180-day period. When you dive into that cost difference is coming from a 65% reduction in imaging and a 58% reduction in surgery.
So if I'm self-funded, that means a lot
It's true
to me,
dollars.
right?
Yeah.
If I'm
Absolutely.
fully insured, that also, if I'm the consumer, that means a lot to me.
Absolutely.
I've got drug card copays, I've got out-of-pocket cost. And really, I think at the end of the day, what you do is you find the root cause. So you're not
Correct.
just masking the pain
Right.
with a med, which is what I want,
Right. Right.
but I haven't done
Right.
because I'm smart enough
Yeah.
to understand
But not
Airrosti.
smart enough to go to a Rossi.
Not-
Right.
exactly,
Right.
exactly.
Well,
So we'll
stubborn.
fix that.
I think
We'll
that's
figure
the
that.
stubborn. I even made you
Yeah.
an appointment basically with
I
Dan,
know,
and
I
it just
know.
didn't
We'll
happen.
fix that.
So
We'll fix that.
yeah, we will fix you. So we'll take care
And
of that.
we're opening in Dayton next month, so you have no excuse left.
Yeah, so in October you're going to have your first date and location.
Yes.
So how many locations across the country right now?
Close to 200.
Okay.
Majority of those are in Texas, most of the major markets. We're also in Virginia. Here in Ohio, we're in Columbus and Cincinnati. We're also in Chicago area and Seattle.
And so we've got in Ohio, we've got Columbus, which is fairly new,
Yep.
right? That's
four,
been open.
4 locations there.
Okay, and
7
then
in Cincinnati.
Cincinnati, and then the Dayton location is coming in October of 2016.
Yes.
So we're super excited about that. So I'm going to go back to something you said just a minute ago. You talked about the session being an hour with the patient, right? So the patient makes the appointment. It's an hour. We've got, about half that time with the provider. This is my own personal experience. The other half with the person who's going to show me how to do the exercises. They're going to get on the floor with me and do those exercises and make sure I understand them. The average visit that someone would have if they went to regular doctor, OT, PT, their primary care,
7 minutes.
Yeah. And
Is the
so,
national average.
yeah, and so in 7 minutes, they're going to look at them, maybe not even touch them, or maybe move their leg or knee around or whatever a little bit, possibly show them how to do. Look, I'm a pretty smart person, and they showed me how to do the exercises, and I was like, Jess, I don't have. I mean, she had to sit on the floor and show me how to do it, which is part of the protocol.
Right.
But otherwise, I would have been doing it all wrong,
Yeah.
maybe making it worse, right?
Well, and that accountability piece with our patients is huge because if you're coming back 6 months down the road with the same injury, we didn't do our job. And so we do dedicate 30 minutes to teaching you. If you truly stick to this homework plan, you're going to be able to take care of this in the future on your own. And that makes us look better. It makes you look better. It's going to keep the overall cost down.
Yeah.
So Derek, if I'm an employer and I'm interested in this, unpack some of the different ways that we can learn about your organization. So before you answer the question, you mentioned a Truven study. So if you could send that to us and we can put that on healthierbirthdays.com, that would be great as
Sure.
a resource. And then also we'll unpack some of the material that you talked to our clients about today inside MB, and we'll put that on our website. So if I'm an employer, how do I learn more about your organization?
I would encourage you to reach out to me here in Ohio. In other markets, I have colleagues who are in the same type of position where all I focus on is figuring out how do we best impact your population. And what that looks like for us is engagement. We have developed a program called PREACT that stands for, you can tell we love acronyms, stands for Prevention, Recovery, Education, and Activity. And this is the way that we get information out to plan members, but also teach them how to stay out of our office. So it's anything from lunch and learns to on-site treatment days. We'll actually set up on-site clinics with large employers, and then all sorts of education through email, lunch and learns, and newsletters.
That's perfect. Well, first of all, thanks for being here today with all of our clients. Secondly, thanks for the impact that you're making in the lives of people.
Well, it comes down to our doctors, and these guys are the rock stars. And I always encourage folks, if they're not sure about us or they want to figure out Airrosti, either come to us yourself or send somebody to us, and you'll really understand the impact we're having.
I'll just finish up with this. I mean, the impact for me as a person, I made the appointment. I was a little nervous about that because at that time I had to drive to Cincinnati, which required me to take some time off of work. My elbow hurt. It didn't end up being my elbow at all. It was my back. So, I'm complaining about my elbow because that's where I felt the pain. But before my visit, the doctor called me and he said, "This is Dr. Poole, just calling you to make sure you know where we are, talk to you a little bit about your visit before you come in." I thought, what? Like, the doctor called me? What the heck? I was so impressed. And when I got down there, it was everything he said. And it was just a different experience than I have had in healthcare, period. I didn't have to deal with someone up front who really didn't know. And I was very, very impressed.
Yeah, and lastly, for our listeners, on behalf of McGohan Brabender, I mean, this is not about just reducing cost, right? This is about improving productivity in people's lives.
Absolutely.
Right? So that's its big mission. So when we talk to our own clients about this, or the marketplaces in Dayton, Cincinnati, and Columbus, and the people that we serve, we have an army of people inside of MB that understand Airrosti. So if you're interested, call us.
Right.
We'll put resources out on healthierbirthdays.com about Airrosti, who they are, Derek's contact information, and we just want to thank you for listening.
Yeah, and before we get on the next podcast, Scott's going to have his wrist looked at.
There we go. We'll have a follow-up
We'll give you an
podcast.
update on that during,
I'll make you a
during
deal.
the next session.
You wrap, I'll get my wrist looked at.
All right, we'll talk offline about that.
Exactly. Have a terrific day.
Thanks.
Thanks for listening and opening your mind. If you're interested in learning more, you can reach us at scott@healthierbirthdays.com.
Or Ann at healthierbirthdays.com. We hope you'll join us next time
on Side Effects.